Good afternoon, everyone. We're here for and welcome to the monthly meeting of the Allegheny County Jail Oversight Board. Just to state the rules up front, everyone in the meeting will be treated with dignity and respect. There is no exception. There is no exception to that rule. And we would like to give everyone an opportunity to be heard at the appropriate time. We're going to start the meeting a little bit differently. We've received a public comment from LH who stated the following: 3 people who were incarcerated at ACJ died in September: Vinkley Harris, Justin Brady, and a third person whose name has not yet been released. I think the board should hold a moment of silence at this meeting to honor their deaths, or at the very least say their names so they are entered into the record. So I think we should take a moment of silence. All right, thank you. I think that was a lovely way to start the meeting, and I will do the roll call again because the public was not present, and also we have other people that were having difficulty getting on from the board, and I think they are now present. So, Ms. Hallam?
Here.
All right, Mr. Pilarski?
Present.
Mr. Kamara?
Here.
Ms. Klein?
Here.
Judge Lazzara?
Present.
All right, Ms. Moss will not be with us today. She's not feeling well, so we wish her a speedy recovery. Chief Kraus, were you able to get on? All right, so hopefully he will join shortly. Sheriff Mullen is on vacation, and Ms. Wagner.
Here.
All right, thank you. All right, so the first item on our agenda is a presentation by Erin Dalton, Director of Allegheny County Department of Human Services, and she's on, so I'm going to turn it over to Ms. Dalton at this time.
All right.
Excuse me, Your Honor.
Yes.
Excuse me, it's Michelle Morse with the program for offenders. I'm going to have to leave the meeting because I have an emergency here at work now. I just wanted to let you know, okay?
Okay, we can start. Do you want to give your report, or do you have to leave?
I can give, I mean, it's really brief. I just can, if that's okay, I can give it and then I can leave the meeting.
All right, so we'll just
do
the corrections and then we'll do the presentation. So you can start, Ms. Morris. Thank you.
Okay, thank you so much. I just basically wanted to say that our census, in terms of our clients at our active facility and our West Holmes facility, have been increasing. Our numbers are really rising, so we're really glad about that. And we have right now about 85% of our staff who are fully vaccinated. 85% of our residents are fully vaccinated. And we just have one of our staff who just received their booster for Pfizer. So we're working on that now. So we're starting to have staff receive a booster vaccine. Also, we just had our pre-audit in September 23rd and 24th, and we did well with that, and we passed our audit. So, okay.
Great. Does anyone have a
report?
Thank you. Any questions? Thank you.
Thank you so much. Thank you.
All right. So then can we hear from Renewal?
Yes, good afternoon. This is Adam Zach reporting for Renewal Incorporated. Yesterday on October 6th, representatives from the Allegheny County Jail Collaborative conducted a focus group with 6 of our reentrants at our Boulevard of the Allies facility. This is in cooperation with the Department of Human Services, and their goal is to receive feedback from individuals residing in alternative housing and how the Jail Collaborative can improve services and support moving forward. We were informed that the meeting went well, and they were very appreciative of the feedback they received and the willingness of the men to participate in this focus group. And that concludes my report.
Thank you. Does anyone have any questions for Mr. Zach? Thank you. And last but not least, electronic monitoring. I thought I saw Steve Eswine on. Are you there?
I need a chart.
Are you there, Steve? All right. I thought I saw him on earlier. So we'll we'll skip that. We'll come back to electronic monitoring and we'll go to Ms. Dalton's presentation.
All right, Judge, I'm out and about in McKeesport right now, so taking this call from the car. I felt like my computer was moving kind of slowly when I had the video on, so I think I'll leave it off if that's okay. I think you're all familiar with me, and thanks for allowing me to present. I'm going to share my screen and some slides, and hopefully it all works. And anyone, please do feel free to yell if something goes wrong on the tech. And it's a short presentation, so we'll have time for some questions after. So you can see my screen. Yeah.
Yes. Yes.
Okay.
Thank you.
Great. So this is a brief presentation. Just want to give an update on some of the Human Services and Allegheny County Jail training efforts. We've worked with the jail for many, many years, as folks know. We just heard about a focus group that we were doing to get feedback on alternative housing. We do that kind of work inside the jail as well. We also collaborate around training. It's certainly been harder during the pandemic, and as things are hopefully getting better, we're kind of doubling down on some of our training efforts and wanted to give an update. So, you know, this is a particular type of training that DHS can work with our partners to offer, and we see it as a bit of a layered approach, with mental health first aid as kind of the first line of defense, first opportunity that we want everybody in the jail to be trained in. There are people in the jail staff who are trained and certified in mental health first aid, who are able to train the trainer, but we want to make sure everyone is fully trained, and that we have much more opportunity for a train the trainer type approach inside the jail. We're also working on, and again, not new, but a intensive, at least 4-hour, hopefully for all jail staff, verbal de-escalation training that we're working with partners to reformulate and finalize for, you know, post-pandemic, hopefully, as we're coming out of the pandemic deployment. And then crisis intervention training, which is a far more advanced and detailed and longer course. This is 40+ hours. We'll do this, we'll start to roll this out over the next, we'll do some planning hopefully, and then roll this out as we get into next calendar year, and likely probably not offer that to every jail staff, but to many within the jail. And then we're going to be open for other ideas. You'll see in a second we applied for a grant from the Justice Department. If we're selected, we'll be working with other communities on what might add to this effort, to this approach. And I'm certainly interested in hearing ideas from you guys as well. So that's the basic presentation. I'll go into just a tiny bit more detail about each. So mental health first aid is an 8-hour training. Many of you are familiar, certainly Judge Lazzara so provides basic education on how to identify, understand, and respond to signs of mental illness, substance use disorder, including risk factors and warning signs for mental health concerns, and strategies for how to help somebody cope in both a crisis and non-crisis situation, and provides real tools for engaging someone who might be experiencing a panic attack, suicidal thoughts or behaviors, self-injury, psychosis, and so on. So that's an 8-hour training, and as I mentioned, we're hoping to roll that out by hopefully by the end of the calendar year to all jail staff beginning this month, and we'll start with mental health department intake, mental health pods, and segregation. And then we're going to be offering additional support and spots for a train the trainer opportunity. It's a 3-day training, so that will give the jail more capacity to train themselves in an ongoing way. So we have 5 ACJ staff who will participate in that training, and I believe that's in November, and we can continue to get folks trained so that they can train others. De-escalation training, again, not new, but we're working on how we're going to roll it out this time. So we are envisioning this, but it's still in the works as a 4-hour training. We're in early discussions with the Crisis Training Institute at Western Psych. This kind of training would be a portion of, for example, the CTI's comprehensive crisis management course. And regardless, we'll work with a very qualified partner to increase the confidence and intervention skills in crisis situations. So again, that's why we think it would be helpful to all staff, maximize team effectiveness and cohesion in the midst of a crisis, understand the impact of trauma and the importance of providing trauma-informed care, identify key factors in the safe resolution of crisis situations, and enhance suicide awareness and provide intervention skills and so on for folks at risk of suicide. So this is something we're hoping to get finalized and rolled out to all staff by the end of the year as well. And then, as I mentioned, CIT is a much more intensive effort, and it's been typically used with law enforcement and public safety officers, but this type of training can also be used for corrections, and so it's a 40-hour training, builds on the mental health first aid base, and again is much more intensive. It brings best practices to jail staff to effectively intervene and de-escalate for people who have behavioral health symptoms. Includes focus on scenario-based skill training, which can be tailored to the particular and specific conditions in correctional settings and in the ACJ in particular. And then, as I mentioned, the county applied for a DOJ, Bureau of Justice Assistance grant to fund the support for planning and implementation of that CIT for corrections. But even if we are not awarded that grant, we will be moving ahead with planning and implementation. We're hopeful and think it would be good to partner alongside other jurisdictions, tailoring it to correctional and particularly jail situations. So this is just a bit of the timeline. You see the mental health first aid, working on getting that done October through December. Verbal de-escalation, hopefully getting implemented. Someone put this together for me, so hopefully maybe we can be complete by November, but that is a pretty aggressive timeline. So hopefully, though, by the end of the year, getting everybody trained. Then we'll be working on more of the train the trainer type work for the mental health first aid, along with the kind of planning for this CIT adapted to corrections and implementation as we go into next year. So this is just a summary, I think, of everything I just mentioned. So I'll stop sharing my slides. Maybe I'll attempt to turn on my camera and take any questions or comments.
On mute. Does anyone have any questions? Ms. Hallam, you're on mute. There you go.
Thank you. Yeah, Erin, I just wanted to thank you and everyone at DHS for just, taking the initiative on having an active role in training at the jail, especially in regards to mental health crises. But I guess my question would be, after the training is completed, will there be any tracking done to see like how the training has been implemented, how it's been used, anything like that?
Yeah, I think that's a good idea. One of the things that I want to make sure we have in place is ongoing tracking to make sure that we don't fall behind, so that it's the case that everyone's always trained and we're doing refreshers as needed. So we should definitely be tracking who's received it, last time they received it, like making sure we're tracking certifications, and happy to get feedback, just like you heard we gathered feedback at the alternative housing facility. We can gather feedback on how, if certainly I know at the end of these courses there's kind of satisfaction with the training and whether they think it'll help them in their jobs, but we can there are, I know, follow-up surveys we can do from that too, and take a look at that. The University of Pittsburgh, I think, did that for the Bureau of Police for many years, so there's a model for that, and we can take a look at whether that would work here.
Awesome. I am really excited to see how everything goes. Thank you again, and if we as a board can be of any help whatsoever, just let us know.
Okay.
Ms. Klein?
Just thank you again, Erin, for doing that and including Western Psych, because I think we're lucky as a community to have a world-class institution and taking advantage of their skills. My question is, are you able to share that with us, the PowerPoint, just so we can
Sure.
go back? Thank you.
Absolutely. Yep. We will, I'll get it over to Greg and Judge Clark. Yep.
Thanks.
Any other questions? All right, thank you, Ms. Dalton.
Yep.
It's exciting, so we're looking forward to seeing the results. Is anyone from electronic monitoring now on? Okay, so the next item on the agenda is a review of the minutes. There were 2 sets of minutes that were sent out, the minutes from the September 2nd meeting and from the September 20th special meeting of the board. So at this time, they were sent out. And again, much thanks to Ms. Carroll, who does an excellent job, a yeoman's job at pulling it all together and getting it out to the board in such a timely fashion. So at this time, I will entertain any additions, corrections, or a motion.
So moved.
All right. Is there a second?
Second.
All right. Any discussion, any questions? All those in favor?
Aye.
Aye.
Any opposed? All right, the minutes are approved, and again, with thanks to Ms. Carroll. So at this time, we're going to go to old business and to see if there's any update from the Incarcerated Individuals Welfare Fund Subcommittee. Judge Lazzara.
Well, unfortunately, because of many scheduling conflicts among everybody and the fact that we had 2 board meetings this month, we had a hard time getting together as a subcommittee, and we will certainly do a better job of it next month. I did receive an update on the PIT survey. Actually, Brad Karinsky was very kind to provide that update for me. So I don't know, Brad, if you just want to give that.
Hello, Judge Lazzara. Hello, board. Brad Karinsky, Public Information Officer of the IIWF. Had some really positive emails from the folks at Pitt who are working really diligently in preparing the survey results. First of all, had a really good response to the survey. And I think a lot of credit for that goes to the jail administration and the warden, who really worked very diligently in getting the survey out. And the Pitt School of Social Work, pleased with the responses, the detail of the responses, and they will be putting together in the next month the results for the board to see. And then hopefully there will be something that I expect there will be something that we will share with the public and the jail administration. I think it will be from what I've seen thus far, I think it'll be very constructive to give us a good insight on how we can better spend the IIWF monies. So thanks to everybody involved. And again, they were very appreciative of the work that everyone in the jail did with them to help complete the survey in what they really found to be, it was unexpectedly very easy to do. So all the hurdles that we had anticipated, I think the jail worked very well to ease us through that. So thanks to everyone, and look to have more on that shortly.
Yeah, we certainly really appreciate all the work that everybody did to get the survey done, and we can't wait to see the results. We think that it's going to be really important results that will help guide us as we move forward and in terms of how that fund is used. So we're very excited about it. I'm sorry, Terry, I cut you off.
No, that's okay. I just wanted to add that Dean Farmer, I think, was surprised at the amount that got included in the free text space. It seems like the residents at the jail are really giving a lot of information, and that she's had to add people to help do data entry. So if we thought we'd have the results by now, I think she was just kind of, I don't want to say overwhelmed, but unexpected with the amount of material.
Great. That's very exciting. So a lot to look forward to. Does anyone have any questions for Judge Lazzara or any other of the members of the committee?
I just have to say how much I applaud Terri for really digging in and getting us all in this direction on this and all of this work. So thank you, Terri.
Thank you, Terri.
Anybody else?
Yeah, I just have a question. Do we know if there was anyone who was excluded from the opportunity to participate in the survey? And if so, for what reason? Anyone really who wants to answer that?
Bethany, I don't believe, I know we were concerned about that. I don't believe that categorically there was. I mean, I can't answer for all of the, 1,600 residents who may have filled out a survey if they didn't get the chance or not. But I don't think that there was anyone intentionally excluded. I think the attempt was to get every single person doing a survey. Now, whether that, of course, happened or not for various reasons, I don't know. But I think both jail administration and Pitt tried to get 100%.
Awesome. Thank you so much.
Great. Thank you. Anything else, Judge Lazzara?
We are looking forward to having a meeting as soon as we have some more information from Pitt, and we'll be working on that and our other pet project of the liaison position, and we'll have certainly a lot more to report next month.
All right, thank you. So next we'll move to Warden Harper for an update on the policy for the Polycom devices to be used for meetings with other providers. Warden Harper.
Hey, good afternoon, Board. Jan, I want to apologize to you because I initially told you that the policy was going to be completed by this Jail Oversight Board meeting. We ran into some technical difficulties, so the policy is not completed. The issue is the scheduling portion of the policy. We're trying to come up with a way in which the professional visitors can schedule the appointments from their computers, and we're just having some difficulty. So hopefully we can have that taken care of by the next Jail Oversight Board meeting.
Thank you. All right, so we'll move to, is there any update on a plan to resume visitation in the jail? There were a few public comments that asked that question, when will visitation resume? Can you shed any light on that, Warden, at this time?
Your Honor, right now, we don't feel comfortable in having visitation at our jail right now, but as soon as we feel that it's safe, with consultation with our health department, we will resume visitation at our jail.
All right, Ms. Hallam?
Yeah, is there anybody coming into the jail right now, like for any programs? I guess anyone outside of legal representation, is there anyone coming into the jail?
We still have program service providers that have been employed by the facility that have worked throughout the pandemic, but we've not utilized all of the contracted partners or the volunteers that we're used to. So we've still maintained some services, just in a very reduced amount, and we've been restricted either to the level gymnasiums or the housing units themselves.
Oh, okay, are any specific metrics being used? I know you said you do this in consultation with the health department, but are there any specific metrics, like when cases in the county go below a certain metric, when vaccination rates hit a certain number? Are there any specific metrics that maybe we can be looking out for to know that jail visits will be resuming when we hit a certain point?
It's been fluid the entire time, and I can say that we are trying to establish what that metric would be. As you've noted, and we've seen, the case counts in the county are reducing, vaccines are increasing. So we are seeing that in our institution as well. We have a lower case count in our institution, but it's only been about a week where we've seen those numbers. So as we know, the incubation period, this isn't enough of a timeline that we can make the determination to reduce restrictions, but we are very, very hopeful, again, as we continue to increase with vaccination, that we are very close to being able to resume some of the normalcy in the institution.
Okay, thank you.
Any other questions or comments?
Can I just confirm also, I believe that JRS is also able to come in to do in-person interviews with folks, especially if they can't get on the Polycom things. And so that's been quite helpful.
Yes, just to confirm that, Judge Lazzara, you're absolutely right. Anybody who is assisting us in getting individuals into our alternatives to incarceration, we've been working with either through video or in-person visit.
Great, thank you. Anything else? All right, and then I would ask Warden Harper, is there any update on the plan regarding this solitary confinement ban ballot referendum?
So what I would like to advise the board again is about our prohibition against using the restraint chair beginning December the 5th. And one of the things that we're going to do to ensure the safety of our inmates, and I want to give you guys some data before I do that. In 2020, there were 674 individuals placed in a suicide gown. 374 of those individuals were placed in a suicide gown in our intake department. The restraint chair was very important to the jail to keep these individuals safe. Starting December the 5th, we will not be able to utilize the restraint chair. So I want to advise the board again that we're purchasing padded cells. The padded cells will be utilized to keep these individuals safe. So I just want to keep the board apprised about us purchasing the padded cells to keep these individuals safe. So far this year, in 2021, there has been 434 individuals that have been placed in suicide gowns. And out of the 434, 232 took place in our intake department. So I just want to give you guys some data as to why we need the padded cells since we cannot utilize the restraint chair. So that's all I have on an update with the compliance of Chapter 205.
Well, Warden, I have a question. Will the padded cells be in different places in the jail? So, because you mentioned that there was sort of a high number of folks placed in the suicide gowns and intake. So will there be padded cells in intake and in other places in the jail, or will they be sort of located, put in one location?
We will have 3 padded cells located in our intake department and various units such as our mental health units, segregation units, where we're going to put other padded cells. Yes, ma'am.
Thank you. Does anyone have any questions? Ms. Wagner?
Thank you, Judge Clark and Warden Harper. First, thank you. I think it's really helpful, Warden Harper, for you sharing with us some of those statistics, because I think, as we all are aware, the referendum, all parts of the referendum really did come about because of what was known publicly as a use of force problem in our jail. So I think, other than Mr. Korinsky, who had come down to the jail to be able to view all of the restraint chair uses, because that at the time was the only way that that information was made available to us as a board. So he took the assignment, thankfully, on our behalf, and went there and was able to view them to report back. But I would just like to say, to the extent that we can continue this, it is very helpful for us to have the statistics and some of this context on use of force numbers in different areas within the jail. So I appreciate hearing some numbers and would certainly like to see more, but would also just add, just for one point of clarification that I think is important since our last meeting, that when we heard from even Mr. Rainey, who did talk about the restraint chair, I think it's really, really important to clarify that he was talking about it as a best practice, for lack of a better term, as it pertained to transport and not as it pertained elsewhere. So I don't think that's at issue, but I thought it was an important clarification to make here. Thank you.
Okay, thank you. Ms. Hallam, did you have your hand up?
I did, yeah, thank you, Judge Clark. So I just have a couple questions about the reporting mechanisms that have already started for the solitary. So the first thing is, how do you track the duration of someone held in solitary? Like, do you complete a form for each day someone's held in solitary? Do you track it electronically? Like, if someone was in solitary for August and September, do you have a record of the number of days they were held there for each month? I'm just kind of looking for a cumulative number.
We're tracking solitary confinement by use of our OMSE system.
Okay, so it is electronic. Is it cumulative?
And what does that mean, Ms. Hallam?
For example, if a person was in solitary for August and September, in your September report, are you putting that they have been in there for 30 days, or are you putting that they have been in there for 60 days?
We're putting in the report the monthly totals.
Okay, so one would have to go back each month in the report and try to match up the demographics from a person in previous months to the current month in order to keep track of that?
We're just reporting the monthly totals, Ms. Hallam.
Okay, because in the June report, you were reporting cumulative data, and I've noticed that that has stopped, and I'm wondering why. For example, I have the June report in front of me. There's someone who was in there for 238 days and 3 hours. That's not all for just June. There's someone who was in there for 148 days and 13 hours. 684 days and 19 hours. Those are cumulative numbers. Can you explain why you changed your reporting?
We changed the reporting because in accordance to the referendum, what our understanding was is that we were supposed to report the monthly totals, man. So if you guys would like to have the cumulative totals, you could do just as you say, go month to month to find out exactly what's going on. But we changed that because we felt as though that's what the chapter 205 stated.
Okay, and then next question is about folks who are in lockdown or solitary. I feel like the whole jail is on solitary right now on 23-1 because of COVID, but how many times was the entire jail or part of it in lockdown due to COVID? The September report that was given by the jail says none. Is that true? Has the 23-1 for COVID lockdown stopped?
In accordance to the referendum, it says it's got to be locked down for 24 hours. During the month of September, there were no pods that were locked down for a total of 24 hours.
Okay, how many pods were there on a lockdown for between 20 and 24 hours?
I'm just going by what the referendum says. I cannot give you that response.
Okay, so solitary, if someone is in 23-1, you do need to report that, even if it's due to COVID. So how many people have been in 23-1 lockdown due to COVID?
I think the report specifies everybody that was in segregation for more than 20 hours in a cell by itself. That report tells you that.
Right, and what I am asking is for you to tell me how many people have been locked down on 23-1 in the month of September.
The September report tells you that, Ms. Howell.
And can you tell me how many people were in lockdown 23-1 for the month of September?
I would have to add the report up. I have not done that, ma'am. But
Gotcha.
the report is on the website for you to see yourself.
Okay, so how many pods are not on a COVID lockdown of any sort right now? Are there any pods that have resumed normal out of cell times? And if so, how much time are they getting out of their cell?
We currently don't have any cell units that are on a quarantine or an isolation status, with the exception of our new admissions to the facility. So our intake housing units, they are still subject to the routine quarantine procedures. All other housing units right now are under normal operations.
Now to 10.
They are permitted to have 10 individuals out, or 15 individuals and 2 incarcerated workers out at all times.
Okay, so how many hours a day are all of the people on a pod allowed out of their cells?
It varies on the population for the housing unit, ma'am. So if the housing unit has 40 individuals on it, they can continue to rotate their time out of cell as everybody is able to get out. So it's difficult for us to provide that as the population continues to change.
Okay, so the only people who are on an actual quarantine lockdown of any sort right now are the folks who are, you said, if you could clarify that again, coming in from intake or in a specific quarantine protocol?
Yes. So every new admission to the facility is subject to their 14 days of quarantine. We do practice isolation for those that are first coming in until they've received 2 negative tests within the facility, as we were having so many new admissions from the community come in and test positive within days of being here. So to keep them separate and reduce disease spread, they've been on an isolation status. They are then reduced to quarantine. Once they have met their 14-day quarantine and have another negative test, then they are released to a general population status. We do still, of course, maintain isolation status for those that are known positives, known exposures until they've met their quarantine period, or have symptoms and have tested negative.
But I just want to clarify, I also want to make sure that we're clear. The September reports indicate all individuals that have been in a cell for more than 20 hours, and that's every cell block at the Allegheny County Jail. And that's what the September report is showing.
Okay, so you are saying that the reports that we've been getting, sorry, I don't want to speak for everyone. The reports that I've been getting that folks are not getting more than 3 hours out of their cell at a time. Those are false. Every single person, except for the categories that you just mentioned, positive cases, confirmed exposure, or intake. There is no one that is not getting at least 3 to 4 hours out of their cell a day.
I'm saying that no one is getting more than 4 hours out of cell time is what I'm saying.
But is everyone getting at least 3 to 4 hours out of their cell a day?
Everybody is at least getting an hour out of cell time, and that's what the report is saying.
Right, but that was my original question, is how many people are on 23-and-1? And that would be the 1 hour out of their cell a day. And you were saying that that is not true, that most people are getting more than that. So what I want to know is how many people are not getting this at least 3 to 4 hours out of their cell a day?
I'm not going to be able to give you those exact numbers, Ms. Hallam. What I can tell you is the report is showing everybody that was in segregation, and that's every cell block.
Okay, thank you.
Any other questions or comments? All right, thank you. So we're going to go to public comments now, and I just want to thank everyone for the public comments and for your interest and concern about our residents who are residing in the county jail. There were a number of comments that dealt with sort of the conditions in the jail, and specifically there were a number of comments that dealt with a lack of hot water in the jail, particularly in the juvenile pod. So there was one from Terri Minor Spencer, who asked, how long have the youth been without hot water, and what are the plans to fix it? Kinda James, the community has been informed that the youth do not have hot water. There were a number of them, Adam Jones, Sydney Allen. I don't know if the warden, if you can comment on the situation with the hot water in the jail.
You know, my response is this, Judge Clark. As with every house and building, there are times in which you have water issues. Once these issues are brought to our attention, we work to address these issues. Activities on the juvenile pod, such as school, still continues, and the jail does have hot water. But there are times, just like in your own home, you have maintenance issues where you have to get maintenance to go in and fix it. And that's just what happened. There was an issue, it was abated.
All right, so that the hot water situation has been corrected, is that correct? Yes, ma'am. Right. There was a question from Ryan Miller about the 23-and-1, and I think there's been enough discussion about that. They were essentially some of the same questions that Ms. Hallam had, but there are a couple of other questions, and so he wants to know, when does the administration plan to lift out of cell time restrictions? We've already discussed about will visitations resume at the jail. When will outside programming like education or volunteer religious groups be permitted at the jail again? So I think all of those questions actually have been answered in the discussion. And as I stated, there were a number of citizens who wrote about the resuming visitation. There was a comment from T. Smith, who says that he was recently incarcerated in the county jail for 26 hours. And during his short stint in processing, he was subjected to extremely unsanitary conditions. Some inmates, he said, had been in processing for 2 or 3 days because there weren't enough healthcare professionals to complete the screenings. He says, I was sometimes in a small cell with 10 or 15 people, which was extremely unsettling during COVID time. And so the conditions got so bad that while we were complaining to the guards, a female CO empathized and begged us to instruct our families to call the news. So I know that later in the agenda, we have done some inspections, and I'm going to ask the board members who did go to the jail to share what their observations, but I don't know if there's no question in this comment, but so I don't know whether the warden or Chief Williams or anyone wants to make any comment on that. So I was reading it because I thought it was an important comment to read.
Well, I think it's important for us to provide a comment because
Sure.
there have been, you know, a volume of times when there's been a slew of new arrests that we're not anticipating come in around the same time when we have a volume and intake that exceeds what we're typically used to. So those things absolutely happen. We do not control the rate in which individuals come into our institution. We do the best that we can as this happens. As a mitigation factor, we test individuals as soon as they come into the intake sally port. So we're completing a rapid antigen test then and there to make sure that if we have anybody who's symptomatic or potentially positive, that we're making sure those individuals are separated out. We're also testing individuals in the back of intake as well once they have been booked and they are, you know, deemed that they're going to stay within the facility. It is a continuous flow. The intake staff works exceedingly hard with a population of persons who are going through different levels of distress. It is not an enjoyable experience to come to incarceration. It's very stressful. People are very worried about, you know, what they may be facing in their own personal lives, legal circumstances. They may or may not be intoxicated. They may or may not be detoxing. So I think that we have acknowledged throughout the last year and a half at least that there have been shifts when we have had staffing compromises, you know, due to our own quarantine or staff positivity rates. So at no point do I want to invalidate the experience that somebody may have had, but I would state that that is not the norm and that the intake staff work exceedingly hard to make this area as safe as possible. I would object to the unsanitary conditions. We have incarcerated individual workers who are also biohazard qualified that have dedicated an enormous amount of their time to keeping that area as clean as possible. The cells are routinely vacated and cleaned extensively. We have brought in certain equipment called Bactronics machines that can do the disinfecting of these areas as well. So I would like to dispute some of the terms that were used in that comment without invalidating the challenges that are faced in that area.
Thank you. Thank you. We had a couple of, yes, Ms. Hallam?
Yeah, those specialized workers that Deputy Warden Williams mentioned that are trained in the biohazard and cleaning, are those specialized workers paid?
Ma'am.
What was that? I'm sorry.
It was no, ma'am.
Okay, thank you for that.
We had a couple of comments that sort of dealt with the special meeting that we had. One was from Malcolm Durridge, who said he would like to thank the board for voting to cease the seesaw training. And in the future, can the jail submit proposed contracts to the board for approval to avoid this kind of situation? And we also had a comment from Rachel Leonard, who wanted to know when are cell extractions necessary. If we could hear from the warden or deputy warden, particularly about the cell extractions, I think it would be important for folks to understand under what circumstances would cell extractions be necessary or warranted.
Cell extractions are done to ensure the safety of the inmate, others, and for the orderly operation of the facility.
And can you sort of give us an example so that someone could easily understand like when that actually might occur, like for instance, I guess?
So say for an example, you have an individual that's suffering from a mental health crisis in the cell. He smeared feces all over the place, urine all over the cell, and he's refusing to come out the cell for any reason. Medical staff, supervisory staff has tried to de-escalate the individual, get him handcuffed so he can get the psychiatric evaluation that he needs, and he refused to come in. Normally what we would do is use the old chemical agent, and 9 times out of 10 they will come out. But, you know, after December the 5th, we won't be able to use the chemical agent. A cell extraction team will have to be formed to get the individual out, to get the individual the help that they need.
Thank you. Ms. Wagner?
Thank you. And thank you, Warden. I thought that example was also helpful. And I'd just love if you could even give us other examples, because I think this is one of these issues that is really at the heart. And when we're talking about where we have some limitations here because of not having access to data and stats, I think that understanding how the jail has been in different scenarios been using cell extractions is very, very important here. So if you're willing to even cite a couple more examples, I think it's a very good question from the public. And I think this is really informative.
You got an inmate just coming to our facility that's trying to harm himself, stabbing himself, using something to stab himself, harm himself. He's refusing to come out the cell for whatever reason, because he's having mental health issues, or having a drug and alcohol issue, and he's continuously trying to harm himself using whatever he's using. He's refusing to come out the cell with verbal commands, so therefore we got to get a cell extraction team that's fully suited up to protect the officers, to go inside the cell to restrain the individual.
Thank you, Warden Harper. Ms. Hallam?
Yeah, so can you explain any situations that do not involve potential self-harm where a cell extraction would be used?
We've had individuals, again, this is related to mental health needs. Obviously, we cannot do on-site competency restoration. You require specific staff and/or licenses to be able to do so. So we'll transfer individuals to Torrance State Hospital. These are individuals who have either not complied with medication or responded to treatment recommendations, who will need to go to another specialized center to receive those services. And you may imagine that they may not be willing or interested in going for that. So we have unfortunately had to extract individuals to get them to the appropriate setting for treatment. There are also some individuals who might be prescribed medications over objection. So when it's deemed clinically appropriate, which in the Commonwealth of Pennsylvania requires 2 licensed physicians, psychiatrists, to co-sign that it is in the patient's best interest to receive medications over objection as the basis of their treatment protocols, that may be another way that we would be providing a cell extraction. So as you can see, a large number of the different examples that we've utilized deal with the populations of those that are acutely mentally ill, may be deemed incompetent to make decisions on their own behalf, or needing emergent treatment or attention due to their own self-harm and behavior.
And are there any situations where you're using cell extractions where mental health is not a factor?
Absolutely. So you might have two individuals in the cell that start fighting, and they're fighting. So one of the individuals is compliant. So that individual will be required to get on the bunk, cover your head, and we ask the individuals that's not compliant to come to the cell. They don't. So therefore, we may have to use a cell extraction team to get that individual. So just two individuals fighting and one being non-compliant or both being non-compliant.
Thank you. Ms. Wagner, did you have another question?
One thing, what is the standard wait time before you send the cell extraction team in? From the time you're made aware of an incident to the time the cell extraction actually begins? Can you give us a time frame on the ideal time that you wait before, deploying that method?
You can't give it time. It's going to be dependent upon the situation. If you got two individuals fighting each other, we've got to do what we have to do to protect those individuals. So no, we can't give you a time.
Okay, there is no policy at the jail surrounding a specific period of time that you should wait before deploying a cell extraction?
Ms. Hallam, I just said there's no specific time. It depends on the urgency of the situation.
Okay, thank you.
Ms. Wagner?
Sure, thank you. Just a follow-up that I think might be helpful for us to understand this, and I think the detail that you're providing, Warden Harper, is extremely, extremely helpful to all of us, as I mentioned before, but as you've continued as well. So I would presume that there's a policy on our cell extractions, and I'm not sure in what form, but some statistics of the cell extractions. So reports and so forth. So what I'd like to ask is that even if for next month, to Judge Clark, if we might be able to entertain even a short executive session where we'd be able to review some of that information.
Well, anything's possible, but I can say my calendar is really jam-packed, so we can talk about that and see if we can do that. But it could be that the warden could, I don't know whether that's something that the warden could just report on and without having an executive session. So I will talk to Warden Harper about that. And if it needs an executive session, I will try to schedule it. If he can present a report for the board at the next meeting without that, then I will ask, we can talk about whether he can do that.
I appreciate it. I'd like to just see a way that we can, view some of the reports that would be with respect to cell extractions. And I was just suggesting an executive session because I know always a concern with any of the policies, how they were viewed by us and how they're accessible to us.
I understand that part. Yes. So I'll talk to the warden about it and then we'll see what we can set up if we need to. Okay. Thank you. Any other questions? All right. There were a number of comments about the deaths that occurred in the jail. One of them was submitted by Daniel Jackson about John Brady, who died in November of 2020. Then the question is, why didn't the jail report his death to the JOB? What is the jail doing? What is the board doing to ensure that all people who die in the jail's custody, whether they are at the jail or after they are transported to the hospital, are reported and investigated? So, and then there's a question about Martin Busick, about about his cause of death. So I would just ask the warden to talk about what happens or when someone dies at the jail. I know that there does appear to be an investigatory procedure. Who does that? How does that happen? And does the jail receive information back from the medical examiner on cause of death, and whether that's something that the jail is permitted to, I guess, release to the public or even to the board? So if you could talk about that a little bit.
First of all, I want to send my condolences out to anybody family member that has passed away at our jail and at our local hospitals. Of course, there's an investigation done by our county police anytime we have an individual that does pass away at our jail or at the hospital. So investigation is done. As far as notification from the medical examiner, you want to talk a little bit about that?
So we do have communication with the Allegheny County Office of the Medical Examiner. And I believe that I have reported in past meetings that we do not have the finalized report. Cause and manner is typically something that is not released by our entity, but could be released by the medical examiner's office. We do have a preliminary or a provisional, but we're not permitted to state that because it is not finalized. I was able to say because it was alleged that his death, Mr. Busick, was a result of suicide. And I did report that that was not even a provisional diagnosis at the time. So it is very difficult for us when we are not the owner of this to be able to provide finalization, but if and when we can, we certainly will. In your first part of the question, you had also asked about the jail's reporting of individuals in our custody. And I think it's very difficult to define, you know, it seems like people want us to do something other than what we can legally do. So if somebody is in our custody and we send them to a local hospital and they are no longer within our legal custody, I'm not speaking about the physical presence within our building, but they are no longer incarcerated. So they've not been in our legal custody anymore, which is a determination made by the courts, not by us. We do not have the right to the protected health information of that individual, and we do not have the right to report on that individual. So when we have been able to, we have made report immediately with the details and circumstances as best we can. You know, always having deference to the next of kin being notified, because we find that that is the most important notification that needs to be made. So I recognize that there are frustrations and there has been disagreement over the last several months and plenty of opinions and commentary, but legally we release what we are able to.
And you know, Jan, I just want to say this also. You know, I want to thank all of my employees, the healthcare team, the correctional officers, for just identifying individuals that need more extensive care than what we can do inside our jail. So I want to commend all of my employees for the work that they do.
Thank you. Ms. Hallam?
Yeah, you mentioned the term legal custody. Can you please define what you mean when you say legal custody?
Certainly. When our facility receives what is known as a 6A release, we no longer have legal custody of that individual, meaning that they are not considered an incarcerated individual anymore. So legally, they are not on our count. They are not somebody that is recognized as an inmate or a remand to our facility.
And is that a court action that has to come from the judge on that person's case, or who can do that 6A?
The court.
It's typically the judge assigned to that case. It could be any judge, though, that issues that court. It is a court order.
And is that the only thing, like, is that required in order to say that a person is released from the ACJ's custody, or are there other ways where they could be determined being released from custody?
To be a permanent release from our institution, we would typically receive a 6A in order to do that, but you could have a temporary release. We would absolutely report on those individuals who are a temporary release because they would still be considered legally within our care.
So who determines a temporary release? Is that the court as well?
A temporary release, and there are many different circumstances, so I'll provide one just to give example. Could be somebody who has multi-jurisdictional involvement. Perhaps they have charges within Allegheny County, Westmoreland County, Washington County. So they've not yet finalized their legal obligations in Allegheny County, but they are temporarily housed in Westmoreland County to deal with their legal obligations there. Another temporary release, it's just one more example, could be somebody who is in alternative housing. They are still considered to be incarcerated, but they are not in our physical building. They would still count as part of our physical, or I'm sorry, not physical, but our legal custody.
Okay, so just just want to make sure I have this right. So if they are on a temporary release from custody, then you would report a hospitalization or death to us. But if they were had the 6A where the charges were dismissed or they were released or whatever it was from ACJ custody, we would not get a report on that under any circumstances, or is that incorrect?
No, that is correct. And one of the notifications within this last month was somebody who was hospitalized for a significant period of time related to COVID-19 who passed away. So that was reported. They were temporarily released, but they were still legally our individual.
Okay, so if just another situation, so someone, let's say, comes into the jail or overdoses at the jail, has another medical condition, is transferred to a hospital where maybe a week later they pass away, would we still get a report on that? I'm trying to figure out when there are deaths or hospitalizations at the jail that we are not being informed of, and when are the deaths or hospitalizations at the jail that we are being informed of. So if you could just kind of draw a clear line in that for me.
There are no deaths in the facility that you have not been made advised of. Any person who has been declared dead within this facility, that has been an immediate notification. And I don't know how to say this in a different fashion other than there are people who may be released from our care. You know, we have a quick release process. We are a central booking agency. People experience their preliminary arraignment here, and they could be released and within the next couple of days could be hospitalized. We do send individuals to the hospital where the magistrate determines that they are an ROR or a non-monetary bond release that do not have to come back to the facility, and they're released. I do not have any outcomes on those individuals when they are not in our legal custody because I'm not entitled to that information. So I don't know how to give you the answer that you're seeking.
No, I mean, you pretty much answered it. I appreciate that. I would say my last question about this is there ever a time where the jail requests a 6A from the court or from a judge, or, you know, how does that 6A come about? Does the jail ever request it?
I have made many requests for releases for individuals who are more appropriate in alternatives to incarceration. And, you know, Judge Lazzara could back me that she and I were discussing a case. This is not somebody who's at imminent risk, but an alternative to incarceration would be appropriate. There are also times when there is somebody who is severely or critically ill. When we do work with the courts, when somebody is incarcerated and in the hospital, they are subject to reduced access to their family. And if somebody is, you know, imminently or severely critically ill, we do find that it's appropriate if the courts are willing to consider that family be able to be involved without any supervision of law enforcement so that they can continue to make those determinations. There have been a number of circumstances in which the jail has advocated for the release of individuals, and we will continue to do so.
Okay, thank you very much.
And this is Kevin Krause from the sheriff. I just want to be clear. Once a resident of the county jail is sent to a hospital and we take custody of that person, they are still in primary custody of the county jail. I just want to clarify that.
Thank you. Thank you. All right. Thank you. And then there were a number of questions and comments, which I will sort of put under the heading of proxy voting. One from Adam Jones, Laura Perkins, Cecilia Torres, and then there were some others too. So the comments were, Adam Jones said there should be no proxy voting. Laura Perkins asked a question: if a member of the board is unable to attend a meeting and wants to send someone to observe the meeting, that person has the right to listen and comment just like any other member of the public, but the president of county council's designee is the only proxy that has the right to speak and vote at the jail oversight board meetings. Can the president judge confirm or deny this? And then Ms. Torres has said her question basically is for me. Why do I continue to allow certain members to send someone else in their place when the regulations clearly state that only the president judge, which currently is you, and the county council president are allowed to send a designee? So I would say this, I will say the statute is pretty clear. There has been sort of some history of people sending designees, and for many years it did not seem to be an issue. I would say a designee is different than a proxy. A proxy is if I can't attend a meeting and I know there's going to be a vote, then in writing I could ask another member to vote for me. And I can't tell that person how to vote, but I can ask that person to vote for me. That would be another member of the board. So if I had to miss a meeting and there was a vote, I could, for example, ask Judge Lazzara, could you be my proxy on that vote? And there is no bylaws for this board. And in most meetings, in many boards, typically proxies are allowed for another board member to issue a proxy. So that's different than a designee who would sit for you. And so it has happened. I had a previous stint on the board back when Judge James was the president judge and I was his designee. And there were many times historically that board members, and I would say the officials, the public official board members have had people serve for them. So that's what it is. I haven't felt a reason to change it. So that's the issue. That's all I can say about that. I mean, that it has been historically that has happened for many years, and you know, no one up until recently has made an issue of it or asked to change it. So that's all I can say about it. Yes, Ms. Hallam.
Yeah, can you point to where in the statute that authorizes the Jail Oversight Board that it says that proxies are allowed?
There's nothing in there, but I would say typically for boards, unless there is a bylaw or something that says that you can't have a proxy, many boards and meetings have proxies. We do it for Board of Judges meetings, for example. If a judge can't be at a Board of Judges meeting, another judge will give a written proxy that whoever is convening the meeting can review and understand that another member has that proxy, the right to vote, cast a vote for that person. And so by the proxy, if I had asked Judge Lazzara to be my proxy, I can't tell her how to vote. She has to vote however she wants to vote on the issue, but she would be I could ask for a proxy. There's nothing in the statute that says it, but there's nothing in the statute that says it can't happen. That's all I'm saying, Ms. Hallam.
Yeah, I would just like to point out that it does specify the two members of the board who are allowed to have designees, and so I would argue that the
designees. What I'm saying, designees are different than proxies.
I understand.
I could ask Klein to be my proxy. Another person that's on the board, I could ask to be my proxy. So I could ask you to be my proxy. If I couldn't come to a meeting, I could call you, send you an email and say, Ms. Hallam, I can't come to the meeting. I know that you have a motion that's going to be that you're presenting on the floor. Would you be my proxy? Because I would like my vote to be cast. I could do that. That's different than a designee. I'm just making the distinction. We're using the word proxy when we mean designee. Those are two very different things. That's all I'm saying.
I would just like to, for the record, say that I've read the entire statute that authorizes the Jail Oversight Board. There is no mention of proxies whatsoever. I would argue that they are not allowed. Just prior wrong actions, allowing them does not mean that they should continue in the future.
Well, I disagree, because reading Robert's Rules of Orders, proxies can be, I think proxies are appropriate if another board member. So I would disagree with that. And I think it's different than a designee. So, if I have to miss a meeting, I might not want to send a designee, even though I guess I could send a designee, but I probably wouldn't. But if I wanted to vote on that, I would probably ask another board member to vote be my proxy, because that would make the most sense to me, rather than asking a designee, someone who has never been to any one of these meetings, to show up and then cast a vote about something that we may have been discussing 4 months. I would rather have confidence in the people that are attending these meetings to be my proxy. So, I mean, I'm just answering the questions that are posed. So, any other comments or questions? All right, thank you. Then there were some questions that deal with mental health, and I think I'm going to, and there were some about the food, and I'm going to leave those maybe for another part in the agenda when we get to maybe Chief Williams' report, and also when we have some comments from the board members about the unannounced visits. There's a question about the liaison from Mr. Kensiewicz. Why can't the board at least temporarily hire the liaison with funds from the welfare fund while they apply to foundations and government programs? I think we just have to work out the particulars. I will say I did meet with folks from the Prison Society this week about the position, and they had some really good ideas, but I haven't had a chance to talk to Judge Lazzara about them yet because it was just yesterday. So I will talk to Judge Lazzara about them so that she can share those ideas with the committee and perhaps invite them to come to a committee meeting. So I think, so that's all I can really say about that, but that's a good question. And then there's a couple of what I would just call miscellaneous questions, which I just will ask the Chief Williams or Warden Harper to comment upon. One is from Richard Engel. Are there social work services for those incarcerated? And so if you could just comment up on that. And then there's a question about how do you send money to an inmate? And that's from Rashima Page.
So yes, there are social work services that are provided within the Allegheny County Jail in a number of different ways. We have positions that are called healthcare social worker. That person is somebody who's been critically important to us. I know that she's gotten shout outs in past meetings. That's Renee, who has helped with some of our placements of individuals who are more appropriate and alternatives to incarceration, like skilled nursing facilities or potentially Torrance civil commitments instead of forensic commitments. So she works very diligently to do that. We have a discharge and release center, and though those individuals aren't all licensed social workers, that is what they're trying to do, is connect them to services. We have discharge planners within the healthcare department. We also have mental health specialists, some who are licensed social workers who are providing those services and support. And our caseworkers throughout the facility do far more than just liaison work between the courts. They are also assisting in identifying areas for support. Lastly, within our substance use department, as well as alternative housing, diversion coordinators, they are all connecting individuals to services as people are reintegrating into society to make sure that they have the supports necessary to reduce any potential criminogenic behavior.
Thank you. And then the question about, for Ms. Page, can you talk about how she could get money to someone who's incarcerated?
So there's several different ways in which an individual can place money on an individual's account. We have the kiosk in the jail lobby. A money order can be sent through the mail with the DOC number of the individual to our mail office. You can also call 1-888-988-4768. You can also go online to jail ATM. Individuals putting money on individuals' accounts must be on the person's visiting list. Any money order over $100 will be held for 10 days.
The jail's website also has a particular section that's called inmate funds. So if somebody wasn't able to write that information down, you can Google Allegheny County Jail inmate funds, and it will take you to the webpage where it provides the instruction to do as the warden just indicated.
Thank you. Thank you. So now I don't really have anything to report, so we're going to go to the warden's report at this time.
Man. Hey, Your Honor, the only thing I have to report to the board is that we are preparing the individuals living in our facility for the election in November of this year. They've been notified about the election through the tablets. They've been given the dates as to when they're supposed to have the registration forms in, absentee ballots in. Last year, 93 individuals voted in our jail. This year, we're trying to have more than 93 individuals vote. That's all I have to report at this time, Your Honor.
All right, thank you, Warden Harper. So we'll move to Chief Williams' report at this time.
Thank you. And I'm feeling very badly because when we referenced social work services earlier, I failed to mention several key departments, and I need to make right on that. So we also have a reentry coordinated group. That's Amy Kroll and her team that are working very closely with individuals. Jack Pischke is our inmate programs coordinator. He also very much assists, and he's been one of the keys within the veterans program as well. And then everybody who works in the Allegheny Intermediate Unit. Without them, our juveniles in the facility wouldn't receive the services that they're indicated, as well as the connection to the community. So before I go into my typical report, I just wanted to make sure that I didn't fail to mention those key players within the facility.
Thank you.
So we'll start with our COVID update. And as typically, I will provide the infection rate. So right now we presently have 2 individuals in the facility out of a population of 1,616 that are presently positive. 1 individual has been in our custody, and the other was just admitted to our facility yesterday and tested positive immediately upon admission. We have 0 individuals presently in the hospital related to COVID-19. We've continued a large volume of rapid antigen testing, specifically during periods of the initial quarantine or isolation time, as well as offering those tests on housing units where we suspect or know there to be disease presence. There have been multiple times within the last month where we have tested full housing units more than one time if there's been a positive case on that unit, to make sure that we are reducing any opportunity for disease spread throughout the facility. In September alone, 4,501 rapid antigen tests were offered, with 4,400 negative, which is 98%. 62 were positive, or 1% of the population. Between both modalities of testing that we utilized, so the PCR, which is the diagnostic testing required for many transfers, as well as the rapid testing, we had 66 individuals unduplicated that tested positive within the last month. It's still a larger volume that we had hoped for, but if you guys recall from last month, it is a dramatically reduced number from what we were experiencing before. In total, since April 12th of 2021, we have offered 11,929 rapid antigen tests, with 11,030 being negative, 298 positive, and 601 that were refused. We continue to remain hopeful, as we discussed earlier, that our ongoing mitigation efforts as well as vaccination efforts will allow us to reduce some of the restrictions in the facility. Within our employee population, we've had 384 staff report that they have been tested for COVID-19, with 170 positive and 214 negative. We currently have 4 employees who are in their recovery process and have not returned to work. I had noted in the end of August, throughout the month of September, we did begin testing all employees that had not demonstrated proof of vaccination at least 1 time a week. We've continued, as you can see, with our mask mandate due to our congregate setting, regardless of vaccination status. So every person within the facility is still expected to comply with that as well. In terms of vaccination efforts within the facility, we still have Pfizer, Janssen, and Moderna vaccines available every day. We do primary clinics between Monday and through Friday for staffing reasons. We have these vaccines available for both our employee base as well as those that are incarcerated in our institution. We've been able to support 1,500 incarcerated individuals in getting vaccinated. Unfortunately, our present count is only 770 of our current population, which is 48% that is fully vaccinated. We did have a much larger number, but within the last week, which is a good thing, we've had 120 individuals who have exited, more than that actually, but our count is 120 less than it was last week. We lost a large volume of individuals who are vaccinated to transfers. So our total number came down. In the last month, we provided 32 Janssen, 60 Moderna, and 45 Pfizer vaccinations to individuals who are incarcerated. We are still applying the $25 that you all had supported to their accounts once they are fully vaccinated, with the exception of those that have been completed since October 1st. So we're still running about a week behind in making those deposits. In terms of employees, on September 29th, County Executive Rich Fitzgerald announced that all employees employed, not just at the Allegheny County Jail, but certainly within our institution, will be required to provide proof of vaccination to department management by December 1st of 2021. At this time, out of the 603 county employed individuals, 356 have provided proof of vaccination, accounting for 59%. We have 8 or 1% that have provided proof of partial vaccination, and 239 or 40% that have not provided any proof of vaccination. And that comes from variations of job classifications throughout the entire institution. Would you like me to continue with my other reporting, or do we have questions for COVID?
I think there are some questions on COVID. Ms. Wagner? You're on mute.
Thank you. Just a quick question, Deputy Warden. Could you give us the number of corrections officers and other staff at the jail who do have direct contact with the public, with the residents at the jail?
Right now, I could not. I would also need you to maybe define that a bit more. I recognize that direct contact is anybody that has contact with an incarcerated individual, which would be every employee, because we do have incarcerated individuals in our employee lounge. But if you meant those that are having continuous or sustained contact, that would look differently.
So I would define it generally as, individuals who are in your accounting department. I would presume that those are not the individuals that we are most concerned about. I understand that as we approach December 1st, we're concerned about everyone now, and we're certainly concerned about everyone then. But I'm asking more for the COVID exposure, particularly for the residents.
Thank you for the clarification. I can certainly provide that at next meeting, but I would have to analyze the current data in order to do that. That's the parameters are helpful though.
Ms. Hallam?
Yeah, does the jail have a plan for any staff members that will not be vaccinated by the deadline? Like if there is a mass exodus of ACJ staff members, is there a plan being coordinated for what you're going to do for those who refuse to get the vaccine?
We always going to have a plan in place for situations like that. Yes, ma'am.
Okay, but do you have a plan that does not involve a lockdown of the jail?
There will never be a plan if we have a mass exodus. Of course, the jail is going to be locked down, Ms. Howell.
Okay, are you working on another plan?
There will be no other plan that can be worked out if there's a mass exodus, Ms. Howell.
Are you foreseeing a mass exodus?
I don't know, ma'am.
So as of now, I think you said, was it 40% of staff is unvaccinated?
I did not say unvaccinated. It's 239 employees who have not provided proof of vaccination.
Okay, and the requirement is that they must provide the proof in order to be considered vaccinated, correct?
Correct.
Right, so do you foresee any percentage of those who maybe are vaccinated and just haven't shown you? I'm just wondering, as that deadline approaches, if there is any sort of planning taking place as opposed to just waiting to the deadline to see, do we have enough staff members or not?
We will never wait until a deadline to take action, and I think the warden did state that we are planning. We are extraordinarily hopeful that we're going to maintain a lot of our employees throughout this, and we certainly recognize that there are some individuals who will choose not to comply with this mandate and or maybe is seeking accommodation. So as we continue to work towards this deadline, we will continue to find strategies to make sure that we can safely manage this facility.
Well, thank you very much.
You're welcome.
Ms. Wagner?
Just a very quick comment, and this is more for, I think, the public, because as we all know, within the county, and I applaud the county administration on this, where they implemented a program providing $100 incentives for employees to provide proof of vaccination. And I can only speak for the statistics in my own office that that turned out to be about 80% of the people who initially complied with that right away. So I would presume, and I don't want to elongate this discussion unnecessarily, but I would presume that the county would have some stats just generally, and I'm guessing that across the different departments, some are different. We certainly understand that you probably had, Steve, I don't know if you're able to speak to this, pretty decent compliance just from that incentive plan. Would that be correct?
Well, yes, Ms. Wagner, that is correct. We did see a lot of compliance when that $100 reward, for lack of a better word, came forward. We also know that there are some individuals who have approached members of the department that they claim to have been vaccinated, they haven't provided proof, as Chief Williams said. It's kind of a go along to get along. They might have a very boisterous coworker that they just rather not have to engage or something like that. But you know, they'll have to make a choice between now and December 1st whether they want to provide that proof of vaccination or not. So again, I can't speak to what those percentages may be, but we know some people have come forward and told us, hey, I've been vaccinated, I just haven't turned my card in because if I turn my card in and I'm not wearing a mask, I get questions and I just rather not have to deal with that at work. So again, they'll have to make that choice between now and December 1st. I'm fairly certain that if I'm vaccinated, I'll turn my card in if it's to turn my card in or lose my job. So.
Thank you.
All right, thank you. So can we move to the next part of your report, Chief Williams?
Absolutely. I do not have an update on the build within the electronic health record to meet the requirements as far as the hours or the average length of time. However, our psychologist, in addition to providing direct care services, has been tracking her efforts. Within the last reporting period, there were 182 individuals who were referred for counseling services, with 8 individuals refusing those service offers. Manual tracking of the average session length was approximately 37 minutes. Those that were not personally seen by the psychologist have had access to other service providers in the building, to include mental health specialists, substance use counselors, psychiatric providers, other healthcare staff, and correctional staff.
Thank you. Oh, I'm
Sure.
sorry, go ahead.
I was just going to keep going if that's okay.
Sure.
Medications for opioid use disorder. I know that we've been talking about this for quite some time. Presently in the facility, we have 42 individuals who are prescribed buprenorphine, also known as Suboxone. And within the month of September, so from the 1st to the 30th, we had 99 unique individuals who were prescribed buprenorphine. We've been working with other partner agencies who have not been able to initiate these efforts. So if they have jurisdictional requirements in Westmoreland County, for example, and they can't have their medications for opioid use disorder continued, we have been working with those jurisdictions to do video sessions to try and ensure that we can continue their care so that it is not disrupted during transfer. We've identified a pharmacy. This was something we were working on last month that can provide Sublocade to us. So this is a specialty medication. It is the once monthly injectable form of buprenorphine. And we are seeing more individuals from the community come in with this medication for a number of reasons. Taking a medication one time a month versus taking it daily is something that a lot of people have been seeking within the community. So we do finally have a service provider that's licensed to give us that medication, and we are currently revising our policies to make sure that we can prescribe and administer that within the facility. Additionally, we have an interested vendor that's licensed to provide methadone that is assisting us in our expansion of methadone. So many of you know that this is the final key to the medications for opioid use disorder. We already provide buprenorphine and have been. We've been providing Vivitrol since 2017. And though it's not a medication to treat individuals as an opioid replacement therapy, we have been providing Narcan since 2016 as well. So we've made significant progress towards the expansion with methadone. I can't provide specific details at this time as we're still having these ongoing initial conversations with this vendor, but during the next Oversight Board meeting, I will be able to.
Thank you. There were a couple of questions in the public comments about the medical and mental health. So Elizabeth Stongar says, how frequently are major antipsychotics prescribed and what percentage of forced medication involves major antipsychotics, and is this being tracked?
So I reviewed that one, and it also had included, in fairness to the person that submitted the comment, that there was some confusion related to COs administering medication. It was believed, I think, that that was something that was communicated. I find it exceedingly important that I correct that during this meeting. Correctional officers do not administer medications. The only persons that administer medications within the facility are those that are licensed to do so. Qualified healthcare professionals administer medications. We do have some patients within the facility that are part of the keep on person protocols. So they may have medications that are vitamins that they have within their cell, and they are able to self-administer those medications without that coming from a healthcare provider each time they receive it. But correctional officers do not administer medications. They are, in fact, a part of every single medication administration process within the facility. So all medication administration is observed to make sure that medications are taken and that they are not diverted. And anytime that a patient may require a medication over objection, the correctional officers help do that in the safest manner possible. The person asked major antipsychotics, and I think that that's a pretty subjective way to evaluate it, because antipsychotics would be prescribed as a serious medication to treat a severe mental illness. So one could argue that every antipsychotic that is prescribed is major. Some medications over objection are antipsychotics and some are not. So Benadryl is a medication that may be prescribed in the IM form when somebody needs to be safer in their management. So maybe they're engaged in acts of self-harm. Benadryl might be one of the medications that's prescribed in addition to an antipsychotic or perhaps a benzodiazepine. Those are all clinical determinations that are made by a licensed prescriber, but we do not currently track how many of those are administered. I could pull that information from our electronic health record, but it is not something that's currently tracked.
Thank you. And then Barb Snell had a couple of questions. She wants to know how are medications dispersed for those who need their medications every few hours? How do you handle type 1 diabetics? And what about dietary restrictions and the ratio of patient to medical staff, credentials of the medical staff? And then she had a question about sanitation during COVID.
Yes, so I really appreciated this question because it allows me to provide the public with a lot more information regarding the work that's done here. Many people don't understand the volume of medications that are administered in the facility. We have 1,616 incarcerated individuals presently, and we have many healthcare staff that provide care. One of the questions was related to what is the patient versus medical staff ratio. And patient ratios are typically discussed within skilled nursing facilities, long-term care facilities, and hospital settings. So in an ICU, you shouldn't be assigned more than a certain number of patients. We do not have that same standard within the facility. We do, however, have units that have a higher level of acuity. So we have a medical housing unit, and right now we may have 11 individuals on that housing unit. And at that time, we have a nurse that's assigned to that unit, potentially a certified nursing assistant, a medical assistant. We would have an advanced practitioner or a physician in that area. We would have mental health units that have acute patients. And we would have a nurse on that unit as well. So our patient to medical ratio is not the same as you would see in community settings, and it's difficult for me to define that in a way that would be honest here. So I hope that the context helps provide some response to that question. Additionally, one of those was, how do we give medications for persons who need them every couple of hours? The large majority of the population is medically stable and is able to receive their medications either once a day or 2 times a day. If you require your medication at any higher level of frequency, you may have your medication on your person, as we had discussed earlier, or you would be designated to the medical housing unit or acute mental health units where you could have those administrations happen more frequently. Some people are ordered medications every 4 hours, every 6 hours, every 8 hours, every 12 hours. Some people might be receiving IV medications that require that timeline to be done as well. So we do have designated units to make sure that medication can be handled timely. For our type 1 insulin-dependent diabetics, we have blood glucose checks that are ordered. It could be once, twice, 3 times, or 4 times a day. And then depending on the blood glucose reading, the medications are provided as coverage to make sure that the individual is treated for any of their symptoms or healthcare needs that are happening. As far as dietary restrictions occur, we have a number of different medical diets that were determined by our healthcare staff and the vendor. If somebody is on a low sodium diet because they have cardiac needs, that is actually ordered by a practitioner, and that order is sent to the dietary company. No protected health information, simply that they are ordered a cardiac tray. Same could be for renal, diabetes, pregnancy, or a number of other conditions. We are able to also accommodate people who have allergies to certain foods in their dietary needs. I think I answered all of the questions that were, sanitation, particularly those for who are immunocompromised. As part of the federal consent decree, individuals who are immunocompromised, they've been single cell status. We also have cleaning supplies available throughout the facility. And hopefully, those of you who visited the facility recently can speak to the level of sanitation within the facility and cleanliness.
Thank you.
This is Bethany. I'm on my phone now, so you can't see me, but can I ask a question?
Yes, you may.
Yeah, so I just want to know, I know that you said, Deputy Ward Williams, that corrections officers do not hand out medication, but do they administer COVID tests?
Correctional officers do not administer COVID tests to the incarcerated population.
Okay, does anyone besides licensed medical professionals administer COVID tests to anyone in the jail?
Yes.
Can you explain those situations where that happens?
Absolutely. The health department came on site and trained a large volume of us, myself included, to complete the Binex Now rapid antigen test. We went through a training and certificate process. We had to complete supervised testing as well as doing readings of those tests, and we completed an actual exam to become certified to complete the rapid antigen testing within the facility. So we have some licensed healthcare professionals that complete those and others that are qualified in order to do so.
Okay, and they're only giving it to other staff members. Am I understanding that correctly?
I have provided rapid tests to our incarcerated population, as have many other individuals who are qualified to do so.
Okay, and then my last question is, if there is someone who is incarcerated in the jail that is complaining of not receiving their medication, what is the proper avenue to report that? Is that an email to you or the warden, or is like from me, or is that something that the family reaches out to the jail? What is the proper avenue for that to happen?
There are a number of different ways that that could be reported. If somebody's not receiving their medication, their first line would be through the sick call process, or they could submit a complaint, or they could talk to the nurse that comes to the unit during any of the medication administrations to inquire about the specifics of that. There have been times when either family members, loved ones, supports, or members of the board or even the county manager's office will receive reports where somebody states that they're not receiving their prescribed medications. And anytime we receive that information, we can look into that and have a practitioner review.
Okay, thank you.
Ms. Klein?
Hi, I am referencing from the warden's report. It's Roman numeral 6, healthcare services, under subcategory 3, services. For clinic visits, it says there were 0 clinic visits from 8/16 to 9/15. I'm just confirming if that's really true or if that was an omission.
No, that's accurate to a degree. And I will say this. Throughout the pandemic, the way that we have provided the data has remained the same, though the way that we've provided the services has not. Because we had a large volume of positive cases within the facility, we shut down movement to our physical clinic area. Therefore, we did not have any visits within the clinic. So we didn't feel that it was appropriate to report that we did clinic visits. However, we did have, in confidential settings, our practitioners, physicians, and nurses going to the housing units to make sure that they were meeting the treatment needs of the patients. I appreciate you picking up on that. It was not an omission. We did not transfer any inmates to our clinic area, and that's why it's reported as 0.
Hey, thank you. Just was wondering.
Any other questions or comments? So I want to thank Chief Williams for a very thorough report as always. It's a lot of work to pull all this together for the meeting each month, and we really appreciate it. I just want to, before we move on, also give sort of a shout out to Mr. Kensowitz, who gave me a suggestion about how to present the board comments, to save some of them for when they go with the report. I think it's a much better way, and that makes sense. And so I think we are able to actually get more of the comments in and more questions answered. So I want to thank him for that suggestion. So I'm going to move to new business. And so, as I stated at the beginning of the meeting, members of the board so far have made 2 unannounced visits to the jail. And so I would ask the board members who have participated in those visits to kind of share their thoughts about what happened, what they observed, what units or pods they saw. There were a couple of questions about the food, and I saved those for the presentation because I think we all went to the kitchen. I believe Ms. Klein ate the food, so I'm going to start with her. Ms. Klein.
Okay, thank you. So on September 8th, Councilwoman Hallam and I made a visit to the Allegheny County Jail for around 2 hours between the time of 10:30 and 12:30. And again, have to thank Warden Harper, who took us around absolutely wherever we requested, and all the staff we interacted with were really helpful, and we're very appreciative of the time we took from there doing work. I also want to, I cannot overstate how difficult it is for the Allegheny County Jail with COVID, how hard it is for the staff, how hard it is for the residents there. I saw, you know, staff people were completely masked. The incarcerated people were masked when they were outside of their cells. I also just want to give a shout out to the health department when on one of my visits in the restrictive housing unit, an individual was very concerned about the risk of getting COVID. And I asked if he was vaccinated. He said no. I kind of probed a little further and you know, said that the medical staff would be happy to come and talk to him about administering the vaccine. He said, oh no, they came, and he had concerns about the long-term effects. And I think rightly so, he was advised by the healthcare team that we can't promise about the, so I just want to say, you did reach out to him, and again, I encouraged him to get the vaccine. We toured intake, restricted housing, juvenile pod, the kitchen, and I don't remember the pod number, an acute mental health pod for women. All parts of the facility were clean. We looked at showers and toilets. If anything was found inoperable, a work order was requested. The incarcerated individuals who worked to clean the jail seemed really diligent and appreciate the work that they do. So just, I think, some what I thought were constructive comments from the restricted housing unit were to provide a longer time to use tablets and to be able to have a video visit with their family on the tablets. Prior to COVID, a resident of 8F said that he was permitted one 30-minute family visit per week, but now that he is not permitted a video visit. I was just wondering, is there a reason why people on the restricted housing units can't get video? Sometimes they said long wait times for medical or mental health. The residents in 8F are issued 2 jumpsuits a week and shower twice a week. I personally wouldn't be comfortable with only 2 sets of clean clothes weekly and wonder, I know Warden showed me there's a whole stack, but I don't know why the regular procedure couldn't be 3 changes of clothing a week. And also if residents were asking for 3 times showers a week, and I understand with COVID precautions that could be difficult, but wonder if that could be accommodated. Again, the juvenile pod was on isolation due to a positive COVID case. So they were getting their homeworks delivered to their cells. And again, just what a difficult situation that just is for everybody. Again, we toured the kitchen during prep. The food prep areas as well as food storage were clean and orderly. All workers were masked and had hair coverings. I had lunch with the warden, and I'll just go into lunch consisted of 2 chicken patties with gravy, 2 slices of white bread, baked beans, fresh green salad, and cake. The quantity of food I thought was completely adequate. I found the meal to be flavorful, albeit to my personal taste salty, but again, salt is what makes food tasty. Again, I just have to say I'm disappointed that fresh fruit has been removed from the menu due to security concerns, that the fruit is delivered at the breakfast, that's either applesauce or fruit cocktail. Again, the kitchen has to prepare 200 special meals a day. I just want to acknowledge what a hard task that is. Kosher food is kept segregated. And again, I want to thank the Summit staff workers, Summit staff, and the Allegheny County Jail residents who I think take pride in serving meals. One thing that I didn't know, which was interesting, was 2 sample meals from every meal are saved for 72 hours in case there is a complaint, an issue with the food, so that that meal can be sent to a lab for to be tested. From the Women's Mental Health Pod, this I thought was a reasonable request, would be to ask if a psychiatrist could okay a tablet on a case-by-case basis. I got the idea that tablets were not permitted in that unit. The same resident asked why women aren't permitted to work in the kitchen, because everyone knows women are better cooks than men. But seriously, if women are not permitted to work in the kitchen, then they're not eligible to be certified through the Safe Serve program. So I'm just putting it out there that if that could be available to women. Let's see, complaints about long time for medical appointments and to work on GED and some difficulty accessing attorneys. That was from the mental health. Last, we toured the intake. It was less crowded than usual per the ACJ. We saw people in protective clothing who had been identified as suicide risk. There was one person who had been in intake for 3 days due to mental health issues and waiting for space to open up, but that really seemed to be an outlier. So again, I just want to thank the staff at HCJ for our visit. That's all I have.
Thank you. Ms. Hallam?
Yeah, thank you. I think Ms. Klein gave a pretty thorough explanation of our tour. We did eat the food, we toured the kitchen, intake. Just some things that I would add is it really was heartbreaking to see the children who were housed in the juvenile pod at the jail. I would say that is definitely the part of our visit that had the most lasting impression of me. That is not a part of the jail that I've seen before. In my opinion, it's a part of the jail that should not have to exist. But it was just, I asked every person on the pod, like, what can I do for you? And overwhelmingly, it was that they just wanted basic things like hot water, which I'm understanding now since our visit that has been resolved, and headphones so that they can listen to their tablets. I would say another piece was that I think is very important is I think that going forward with these unannounced jail visits is that we should make a better effort to make sure that they are actually surprise visits. It was very apparent on our visits that the jail knew that we were coming, was prepared for our visit. I was even told by staff members in a specific area of the jail that, you should have been here 2 days ago, and it was an entirely different environment. They knew you were coming. So I think that was my biggest takeaway, is that it was very apparent that it was not unannounced. It was not a surprise like it was intended to be. But other than that, I look forward to more frequent visits and hopefully more visits that are truly a surprise and unannounced to the jail administration.
Thank you. I just a couple of things, and I'm going to ask Mr. Pilarski to talk about the visit that we had together, which was last Saturday. And I would just say to the public, one of the things that we attempted to do, we felt like we should make visits at different times. And so that's including a weekend and so forth. So I just wanted to have a couple comments so that people understand about the juveniles. It is heartbreaking to see the juveniles in the juvenile pod. And I just want the public to understand that the juveniles that are in the jail are charged as adults. No juvenile that is charged in a delinquency petition is housed at the jail, because there's a statute that makes that illegal. There is an effort through the recommendations of the Governor's Juvenile Justice Task Force to change the law so that there would not be these quote unquote direct file cases, that all cases would start out as juvenile cases, and it would be up to the district attorney to petition and to prove that it's in the public interest to try a juvenile as an adult instead of kind of the other way around. Many of them are charged with homicide. So they are in there for very serious offenses. There are other juveniles that are charged as adults, but they get bond, just like adults get bond. So many juveniles that are even charged as adults are not incarcerated anywhere because they've been released either on without any restrictions or with restrictions, but many of them actually are out on bond. So I just want to throw that out there. And I would just say I think the thing that affected me the most at the jail is the overwhelming disproportionality of people of color in the jail. It literally smacks me in the face every time I see it. And I think, and that's whether you're on the juvenile pod or whether you're in the general population, whether you're in the mental health unit or the medical unit, the number of Black and brown faces in that jail is just overwhelming. And I think that's true pretty much in corrections facilities, both local, state, and federal across the United States. So I'm going to turn it over to Mr. Pilarski to talk about our visit on Saturday.
Yeah, thank you, Your Honor. You said we had got there, I guess, right before 9 o'clock, went there early in the morning, and as someone who picks up every paper clip, a little piece of paper on the floor incessantly, I thought the jail overall was clean. There's a few areas that could use maybe a little touch up of paint or something like that, and certainly the elevator that gets used a lot. We even commented about maybe needs some touch up of paint. As Ms. Klein said, all the staff was cordial. All the residents we spoke to were all cordial, very engaged. Special shout out to Deputy Warden Smith, who took us around, and Captain Young, who initially spoke with us and answered our questions while we were waiting to go around. We did go to see a med pass up on 2E. Again, there were some inmates out. It was a general population pod, if I recall. Some inmates were out watching TV, others were walking around, but everything was orderly. The medical staff was passing them out. I didn't see no issues. One thing I did note, and something was mentioned earlier, one of the inmates had come over to Deputy Smith and had mentioned that he's been asking to see a doctor for over 2 months about an issue, and I overheard, so I just wrote down his DOC number, and I wanted to follow up myself. And I followed up, didn't have time on Monday, but in the middle of the week I followed up and was encouraged that Deputy Smith had already followed up on the matter, and I was told that the individual in the last 2 months has seen the doctor at least 3 times on the matter, and it was receiving multiple medications, but his issue was degenerative. And I can speak to someone who's getting older and did a lot of things and didn't really care much in my youth. You get those degenerative knee and elbow things. So, but he is receiving physical therapy and he's seeing the doctor. So I don't know what the miscommunication was or whatnot, but it's my understanding from talking to him and following up that he is receiving medication. It was encouraging he's getting PT and seeing the doctor. And it was encouraging that when asked, the staff did follow up on that and get back to the individual. We also went to the male-female mental health unit, the acute mental health unit, I think for males. Went to the juvenile pod, did speak to all the juveniles. Some were out playing cards. Others, I think it was 1 or 2 others on a tablet. Some others were just having a conversation. It is very disheartening to see. I think we looked at the list and there was a couple 14-year-olds on there, and that's very difficult to see. And I go back to my kids and think at 14, my God, so again, that's tough.
So I would just say this, the 14-year-olds are charged with homicide. That's the only way that they can be in there, because for the other offenses, you have to be at least 15. So they are charged with homicide. And there are several that are from other counties. I guess they don't have facilities that can separate the juveniles by sight and sound. So I know I think there's a few from Lancaster County and maybe Westmoreland County. So there are others. I think one of the things that concerned me when you looked at the race, I think there was only one juvenile on the juvenile unit who was not African American.
That's my recollection too, Your Honor, yes. But again, nobody mentioned any problems with the juvenile pod. One of the mental health units were on, one of the individuals was reading a book. So we did go over and talk to him, discuss the access to the books. He said he doesn't ever want for access. I think, if I recall, he's reading The Outsiders. But he said he's never had a problem having access to books. There was maybe a brief time, quite a while back. I quit counting. There was over 30 books. I quit counting. There was probably another row or a row and a half of books on the cart. I did notice a library card, a book card on some of the other pods we visited. I didn't look on every pod. But like I said, that one that we did speak to said there's really no issues with access to books, so that was encouraging. We visited the kitchen, as you know, same thing as Ms. Klein said. Huge operation, much bigger than I had thought. I had never been in the kitchen before. While we didn't eat on Saturday, I have eaten twice at the jail. The warden took me out on a date, and we've had meals twice at the jail. Certainly, you know, I've tasted a lot worse food. I've tasted better food. But the meal was certainly edible, and I didn't those times when I did eat. I thought the kitchen was clean. They were actually squeegeeing the floor as we were walking through. Did talk to a lot of people down in the kitchen, talked about the meals. They did talk about fresh fruit. We did obviously say how that could be a weapon. That's why fresh fruit is difficult. I know someone had told us they actually use fresh apples for the applesauce, so that's a way to try to introduce fresh fruit. We talked about maybe some leafy greens and other vegetables to try to get as a way to increase and access to vegetables since fruit would be so difficult. All the individuals that we spoke with said there was no issue with quantity or quality per se. You know, they kind of said what I said. They've had a lot worse. They did talk about variety sometimes. They like maybe a little more variety. And it was interesting that one of them said it'd be so nice to daily maybe just have a peanut butter and jelly sandwich. That sometimes that's just all you want is a peanut butter and jelly sandwich. Go back and so even like daily, if they had some type of sandwich choice or something like that. We then went through the entire intake process. Sergeant Judge was kind enough to help us, and we kind of went through step by step. And I don't know if Judge Clark had ever seen that, but I have seen that at least one other time before. But it was interesting to, again, put it in a different perspective to go on Saturday and go step by step. When somebody comes in, the process they go is just specifically now with the COVID protocols and such. Again, nothing seemed out of order down there. A lot of people looked, you know, some of them just came. They had, you know, certainly a different looks on their face than up on the pods. But I didn't see any issues. Certainly nothing of cleanliness. As far as the surprise goes, I know from the guys, there's all those guys watch those cameras. It's about a surprise until we pull in that parking lot. I think we got a good morning as soon as we walked in the door, if you recall, Your Honor. So, I mean, it's difficult. I don't, you know, the surprise is over as soon as we pull in that parking lot. Everybody on those cameras sees who's coming. So I'm sure word passes quickly, but again, there was no major red flags I saw, and I was encouraged by a couple of things like the follow-up with Deputy Smith and whatnot. So unless you have anything else, Your Honor, I mean.
No, I think you did a good job. I was really, the kitchen, it's an overwhelming, it's a huge process. And now I can better appreciate when Warden Harper tells us about the number of meals, because it's like a nonstop production by the time they do all the breakfasts, and then they're during the lunches and the dinners. It's a nonstop production. And so the food looked okay. The proportions, they were actually preparing the tray, so you could see how much food was going on each tray, and it certainly seemed like an adequate amount of food. So all in all, you know, I thought things were pretty good. The pods were very clean, I thought, and I was, I don't know, a little surprised. I don't know what I expected, but there was like literally nothing on the floors. Some of them look like they had recently been painted, so there, you know, seems like there's some things trying to maintain. I think that there's a lot of wear and tear on the elevators. They use them a lot. In order to really paint them and do things, they would have to shut some of the elevators down, and so it's complicated. But they work, and I think that's the major thing, and nobody is housed on an elevator, so I suppose that's okay too, but that's all I have. So I just want to thank the members who went. We are hoping that every member of the board will make at least 2 visits to the jail. So we'll continue to report. I think we are required to file a written report, so we can sort of talk amongst the board about how we want to do that. Do we want to wait till we complete a certain amount of visits and compile them, or how we want to do it? But we will be required to file a written report, which is to be posted so that the public can receive it and view it. All right, thank you. And then under new business, we have some motions. Ms. Hallam?
Thank you, Judge Clark. Okay, so the first is a motion for money from the Incarcerated Individuals Welfare Fund to be put on the commissary accounts of each person in the jail. As of my drafting of this motion, there were 1,653 folks incarcerated in the jail, $50 for each person. That'd be a total cost of $82,650. I would like to make a motion to approve.
Is there a second to the motion? Ms. Klein? I think Judge Lazzara also, but you're on mute. All those in favor?
Aye.
Aye.
Any opposed? All right, the motion is approved. Ms. Hallam?
Thank you. The next is a motion for money from the Incarcerated Individuals Welfare Fund to be put on the tablet accounts of each person. Again, 1,653 folks incarcerated in the jail, $50 for each person, total cost of $82,650. I would like to make a motion to approve.
Second. Judge
Second.
Lazzara?
Thanks.
Any discussion? All those in favor?
Aye.
Any opposed? All right, and that motion is approved. Is there any other business for the board at this time? If not, I will entertain a motion to adjourn. Ms.
I
Klein,
second the
thank you.
motion.
All right, so we have a motion and a second. I think that was Chief Kraus. All those in favor?
Aye.
Aye.
All right, we are adjourned. Thank you so much. Everyone, please stay safe. We're not out of the woods with COVID, so. And all those out there, if you haven't been vaccinated, I'm begging you, please get vaccinated. Thank you.
I second that motion.
Yeah, I third that one.
Thank you.
Thank you.
All right.
All right.
Thanks,
Thank you.
everybody.
Good
Take
night,
care.
everyone.
Good night.
Have a good evening. Bye-bye.
Stay safe.